Your nails, your tongue, your food cravings, and even the color of your lower eyelid can reveal something critically important about your pregnancy. Iron deficiency is the most common nutritional deficiency in pregnancy globally. Most women who have it don't know, because every sign looks exactly like normal pregnancy. Signs 1 to 5. Pull down your lower eyelid right now. The inner surface should be a rich pink or red. If it looks pale or white, that is a significant sign of iron deficiency. Midwives use exactly this check in clinical examinations. Fatigue that doesn't improve with sleep. Not pregnancy tiredness, something deeper. Every cell in your body is receiving less oxygen than it needs. 8 hours of sleep and waking as exhausted as when you went to bed is not normal pregnancy fatigue. That is your cells telling you something specific. Breathless on minimal exertion. Climbing one flight of stairs. Walking to the car. Iron deficiency forces the body to breathe faster to compensate for reduced oxygen carrying capacity, while your uterus is simultaneously compressing your diaphragm from below. Heart palpitations at rest. The heart beating faster and harder to compensate for reduced oxygen delivery. Occasional flutters are common in pregnancy. Palpitations at rest, alongside fatigue and breathlessness, are a specific cluster worth investigating. Persistent dizziness. The brain is the most oxygen-dependent organ in the body. When hemoglobin is insufficient, the brain receives less oxygen. This causes dizziness, and it gets worse when standing quickly. Iron deficiency affects up to 52% of pregnant women in the third trimester, more than half. And the majority don't know, because every symptom overlaps with what pregnancy normally feels like. Signs 6 to 10. Frequent headaches located at the front or sides of the head, caused by reduced oxygen transport and altered brain chemistry from low iron stores. Cold hands and feet, even in warm environments. The body diverting blood away from extremities to protect vital organs. Brittle nails that break, split, or peel. Iron is essential for keratin production. Cracked corners of the mouth, angular cheilitis. Iron maintains the tissue at the mouth corners. Without it, that tissue weakens, cracks, and cannot heal efficiently. A smooth, shiny tongue. Look at your tongue. It should have a bumpy texture from taste papillae. If it looks polished and feels sore, those papillae have disappeared. They are made of rapidly regenerating cells that need iron to repair themselves. The tongue is one of the first places nutritional deficiency shows up in the body. Signs 11 to 15. Brain fog and difficulty concentrating beyond occasional forgetfulness. Iron deficiency measurably impairs cognitive function by reducing oxygen delivery to the brain. Irritability and mood changes disproportionate to circumstances. Iron is a critical cofactor needed to synthesize dopamine and serotonin. Low iron alters brain chemistry directly. Restless legs, an irresistible urge to move the legs at night, one of the most specific neurological signs of iron deficiency in pregnancy. Up to 60% of cases improve with iron supplementation. If this is disrupting your sleep, request ferritin testing specifically. Reduced exercise capacity beyond normal pregnancy changes, arriving faster, hitting harder, recovering more slowly than expected, craving ice or non-food substances. This is the most specific sign on this list. The compulsive urge to chew ice, called pagophagia, is so strongly associated with iron deficiency that clinicians use it as an informal screening indicator before any blood test. If you are craving ice compulsively, request an iron check immediately. What to do? If you recognize 3 or more signs from this list, contact your midwife and request a blood test that includes ferritin, not just hemoglobin. Most routine pregnancy blood tests check hemoglobin only. Ferritin catches deficiency earlier, before hemoglobin has dropped enough to show anemia. A normal hemoglobin with low ferritin means your stores are already depleted. To maximize iron absorption, take iron alongside vitamin C. Avoid tea and coffee within 2 hours of taking iron-rich meals. Tannins block absorption by up to 60%. Space calcium supplements away from iron. Untreated iron deficiency in pregnancy is linked to preterm birth, low birth weight, impaired fetal brain development, and increased hemorrhage risk at delivery. Every one of those outcomes is avoidable with early detection. You cannot feel your ferritin level, but your body is showing you signs. Now you know what they look like.